My name is Dr. Dickens Lubanga. I'm a pediatrician at Bungoma Children's Hospital. So today we are talking about hepatitis B. When we are talking about hepatitis B, we realize that hepatitis B has been on the upward trend, and especially because it's among the diseases which are mainly screened, especially for women, especially when they've conceived and they expect to carry a pregnancy. So usually we normally test for hepatitis B. Majority of the men are not tested because usually most men actually benefit from their spouses because very few men actually go and check their status. So you're saying that hepatitis B has been on the increase, and remember why hepatitis B is an important disease is because one, because of its effects, especially in children. Hepatitis B can cause cancer of the liver, which is a very dangerous disease and counts for significant deaths among all people affected with hepatitis B. One thing also that is that's a bit one thing about hepatitis B, that for the adults, usually most of the time, if you're infected in your adult stage, then you rarely transform into cancer. Just around 5 to 10% of adults who get hepatitis B in adulthood will end up getting liver cancer. But up to 90% of children who get hepatitis B early in their children ultimately develop cancer of the liver. So, and that is why we are talking about hepatitis B. One, how does hepatitis B present? So most of the time, hepatitis B will present with yellow eyes, which we call jaundice, or actually yellow sclera. That means bluish, yellowish coloration of the white part of the eye, which is called the sclera. And majority of them will also present with a rash. Some patients will present with a rash. Majority of the patients will present with fatigue and non-fatigue. You just come, you've not even worked that day, but you feel quite tired. Then the other ones will have pain, especially on the right side of the abdomen, because usually the liver is located on the right side of the abdomen. So majority of the pain will actually be there, especially when you go to the hospital. The doctor will try to palpate the right side of the lungs of the abdomen, and that's when they suspect that there's inflammation or actually there's enlargement of the liver. So those are some of the signs that hepatitis B might present with. In infants or smaller children, it's almost asymptomatic. One might not know even that they have acquired hepatitis B. Apart from if the mother who was with transmission that occurs during delivery, that is from the mother to the fetus, that happens quite a lot, especially when the mother gets the disease in the course of the pregnancy. So that during that period, there's active replication of the virus, and therefore which can easily increase transmission to the unborn baby. How is hepatitis B transmitted? Most of the time is through blood and blood products. So in case you're having a transfusion, or if your blood gets in contact with another open surface, then you can get hepatitis B. Majority of it is also sexually transmitted. That is, if you have hepatitis B and you sleep with your partner or with someone else, then you can easily transmit to them hepatitis B. Now, intravenous drug users, these are people like using intravenous drugs. For example, those who use drugs like cocaine, who tend to inject themselves, they can easily pass it on because they tend to share needles and also other sharp materials. So which can cause a rapid spread from one individual to another. So those are some of the ways that one can get hepatitis B. And usually, how is the diagnosis made for hepatitis B? So you are saying that you go to when you come to the hospital, we send to the lab and request for hepatitis B surface antigen. So usually this is a test that just shows that you have been exposed, you have had previous exposure to hepatitis B. So if you find that it's positive, it means that at some point you were exposed to it. So there are those ones who have chronic hepatitis B infection. That means you have had it for more than 6 months. And there are those ones who have it acutely. That means you have had it for less than 6 months period, or 1 to 3 months. So we are scared about those with chronic hepatitis B, because these are the ones who end up developing cancer of the liver. And so in terms of testing, why we are normally a bit scared is you want to know if you are really replicating at this time. And so the only test that can show that you're having an active replication is called hepatitis B E antigen. That is done in a few laboratories here in Bungoma, but that is the only test that will lead us, because usually whenever you have an exposure, then you'll turn hepatitis B positive in your test, because you'll maintain antigens. Remember, antigens are cells which are produced as a counter to the viral infection. So they'll produce an antigen that will turn positive. So how is hepatitis B treated? So if an infant gets it, that's a child who is just newly born from the mother, usually we give them immunoglobulins for hepatitis B. So we introduce to the child and also vaccinate with hepatitis B vaccine. So we give even at birth, regardless, because this will help prevent them. Because, like we said, most of the children will tend to have a quickly progressive disease to liver cancer. So, and that's why we try very fast so that we're able to save this life. For those adults who are having active replication, usually most of the time we use antiviral drugs. So we use some combination of the HIV drugs that we use to treat HIV. So there's a combination that we use to treat. Usually sometimes it's very difficult to treat, and treatment can last up to 6 months when you use the drugs which are recommended. But the most important thing is prevention. So the good thing that hepatitis B is a preventable disease. We have 3 vaccines that we give, and these 3 vaccines provide a lifetime protection against anyone from getting hepatitis B. And so we normally ask those at risk group. So these include healthcare workers. This include people who have got multiple sexual activities with other people. We encourage them at least to get hepatitis B vaccine, so that to avoid the risk of transmitting the disease to others. And remember, hepatitis B vaccine is not very expensive. It's a relatively cheap vaccine. And so it's easier for you to protect yourself than to actually get a disease that will end up destroying your liver and exposing you to getting liver cancer. So hepatitis B can be prevented, and we encourage people not to share things, especially personal effects like toothbrushes, extremely personal things, and also for those who are using drugs that involve injection, at least each person should have their own syringes. They need to have their own needles to avoid person-to-person transmission. Thank you.